Hello everyone, how are you? Welcome to the physioBRAIN channel. This is Professor Adriano, and today we're going to continue our series of tips and guidance on tests related to functionality, especially for the elderly population and other specific groups. So stay with me and don't miss out on this information. Don't forget to like the video, subscribe to the channel if you haven't already, and share the video with anyone you think needs to know this information. So guys, in the previous video we talked about the gait speed test, and today we're gonna quickly and simply talk about the TUG test, or the timed up and go test, okay? It's a test that is also widely used in the scientific literature for a variety of populations, okay? It has been validated in several population groups. And what does it assess? It measures the time it takes for an individual to stand up from a chair, walk 3 meters, turn around, walk back, and sit down again, right? You might find it referred to as the timed get-up test, or the get-up and go test. It's the timed up and go test. The most common form you will hear about is TUG, right? The TUG, T-U-G, okay? Which is the English abbreviation for the test, all right? It's also a test that can be used to assess an individual's functional mobility, a test used to evaluate walking, and a test used to check balance, okay? So there are some specific cutoff points for certain populations. For example, if the person completes it in more than, above a certain number of seconds, right? It means they may be at risk of falling or that their mobility is reduced, okay? And then you'll do your scientific research to find out the specific population you want to study, what the cutoff point is, all right? So in general, it's a very quick test to administer, very easy, because it only requires a chair and a stopwatch, right? And you can use a marker with tape. With this super production, it's easy to understand, right? I know, it's a test, right? A very elaborate setup, right? So simply put, that's it. It's a quick method to apply, and it's a very, very good test because it provides us with highly relevant information for both clinical practice and scientific research. So if you've already used this test, or if you've never used it and plan to, leave a comment here and tell us about your experience. We really enjoy hearing what you have to say to us, okay? If you have any questions, write them in the comments and share the video. Take care, and we'll see you in the next videos.